If you have a herniated disc, shooting pain down your leg, or that deep back pain that just will not go away, you may be wondering if surgery is your only option. The good news is, for many people, it is not. Spinal decompression can be a very helpful treatment to consider before taking that bigger step, especially when the goal is to reduce pressure, calm irritated nerves, and give your body a better chance to heal naturally. A lot of people hear the words herniated disc and immediately think they need surgery. But that is not always the case. In many situations, the disc and surrounding joints and muscles are under stress, and that pressure can irritate the nerves in your spine. That is often what causes pain in the low back, pain into the buttocks, pain down the leg, numbness, tingling, or a feeling of tightness and weakness. When those symptoms start affecting your work, sleep, or everyday life, that is when it is time to pay attention. Spinal decompression is designed to gently reduce that pressure. The treatment works by creating controlled space in the spine, which can help take stress off the discs and nerves. When the spine is stretched in a very specific way, it may help improve the environment around the disc and reduce irritation. For the right patient, that can mean less pain, less inflammation, and better mobility without jumping straight into a surgical discussion. What makes spinal decompression so valuable is that it is focused on helping the body function better without being invasive. Many patients are looking for something that can help them move, sleep, and get through the day with less pain while avoiding the risks and recovery time that come with surgery. That is one of the reasons we often consider decompression as part of a conservative care plan first. Now, spinal decompression is not a one-size-fits-all treatment. At Waves of Wellness Chiropractic, we look at your symptoms, your history, your exam findings, and what your body is telling us. If someone has pain that seems disc-related, nerve-related, or aggravated by certain movements or positions, decompression may be worth considering. It may also be helpful when symptoms have lingered despite rest, stretching, or other forms of care. A typical plan usually starts with a thorough evaluation so we can determine whether decompression makes sense for your condition. If it does, we will outline a care plan based on your needs and your goals. Some people need help calming down a recent flare-up. Others have been dealing with pain for months and are trying to avoid getting worse. Either way, the goal is to reduce pressure, support healing, and help you get back to normal life as safely and effectively as possible. One of the biggest reasons people seek out spinal decompression is because they want to know they have tried a meaningful, conservative option before considering surgery. That is completely understandable. Surgery can be appropriate in certain cases, but it is usually something we reserve for more serious situations or when less invasive care is no longer helping. If someone is having progressive weakness, severe nerve compression, worsening neurological symptoms, or has not improved with conservative care, then yes, it may be time to talk to a surgeon. But many people are not at that point, and they deserve to know what else may be available first. That is really where the curiosity comes in. A lot of people live with pain for way too long because they assume surgery is their only answer. But often there are still options to explore. The key is getting evaluated by someone who knows how to tell the difference between a condition that may respond well to conservative care and one that needs a surgical opinion. That is what we do every day. If your pain is making it hard to sit, stand, drive, sleep, or enjoy time with your family, please do not ignore it. Back and nerve pain can become more limiting over time, and the earlier you get it checked, the more options you may have. You do not need to guess. You do not need to wait until things get unbearable. You just need the right next step. At Waves of Wellness Chiropractic, we are here to help people in Leland and the surrounding areas find the care that makes sense for their body and their goals. If you have been dealing with back pain, sciatica, or a herniated disc and want to know whether spinal decompression might help before considering surgery, we would be happy to talk with you. Call us today to book your first appointment at Waves of Wellness Chiropractic at 910-859-8359. We are located at 473 Old Waterford Way, Suite 118 in Leland, North Carolina. And if this kind of information is helpful, please like and subscribe so you can keep learning about your options for better spinal health and pain relief. You do not have to keep pushing through pain and hoping it goes away on its own. Let us help you take the next step with confidence.